Okay, we're going to look at the technique live on how to do a cap, put a cap on. One of the things, there's a lot of subtle things that practitioners do that they forget to mention when they're training people. One that was brought to my attention is I was pushing through the holes of the cap just to make sure they're clear. The reason is sometimes you get a little residue no matter how much you clean them in the holes, and it can make it so that it's hard to get the blunt needle through. And then if you push it suddenly with a lot of power and it lets go, you will be stabbing them in the head with the blunt needle. And if you have a child with a sensitive scalp because they're anxious, you will now have somebody who will never come back and sit in that chair again, and you will have to peel them off the ceiling to get them out the door. So that's a lost client. So we want to make sure that we keep this comfortable and pleasant. So now that I'm sure that not only have I cleaned the cap, but that it's clear of any residue, I can put it on. Now when you clean this cap, remember you can't put it in the autoclave, it melts. You don't need to do that. You can buy special fluid to clean the caps in if you'd like them to be really antiseptic and you think you're using a population that has HIV or something in it. That might not be a bad idea. For the most part, you can just clean them with soap and water and a toothbrush. Clean it out with soap and water and a toothbrush. We've talked with a lot of medical experts in the different clinics we've owned, and there seemed to be a consensus among the medical community that that was sufficient in most cases, unless you felt, you know, that there was some danger from a disease like HIV. We're not penetrating the scalp at any point. We're not getting bodily fluids, so it should be okay. Still, in some populations, you want to take extra precautions. Now, the front of the cap, you should notice here's my triangle right here. I'll hold it up, and you can see there's a little triangle here with a little dot on top right there, and that's how I know it's the front of the cap. So you can just look for that triangle when you grab your cap. And as proof, there's the wire coming out the back near the parietal region. Now I'm going to take these two little areas. You can buy little donuts, foam donuts, that you can put over these front sensors that go right at FP1, FP2. And for some people they're very useful because they cushion the cap in front. For some people that really hurts when it's pushing against the front, and what happens is they tense up and you get a lousy reading. So if you think you have somebody with a sensitive scalp, you can always tell if they have a sensitive scalp because you can just do this, and if they go, ow, or what are you doing, or why did you poke me, you'll know that you've got a very sensitive scalp, because most people like her don't respond that way. It's just because it's a blunt needle, and it doesn't hurt or anything like that. But there are people who are exquisitely sensitive, and there's more than you might imagine. Okay, before I put the cap on, now I've explained the cap, I'm going to take an alcohol swab, standard BD, which I recommend because they have more alcohol in them than most. And I'm going to put a little new prep in them. That gives some abrasive material. You can buy swabs with abrasive material in them, but I'm a clinical cheapskate, so I mix them together like this. And then I'm going to go and take all her foundation off of her forehead. Okay? And any oil or dirt that is built up. And we have to rub that good because it's very hard to get a good connection there. Okay, we want to make sure that we get a very clean area. This is the hardest area to get a connection, and if you have to use the blunt needle on the front of the head, that can be very uncomfortable because it's you know, even though the skin's tougher, it's without the hair, the blunt needle is more painful for the people with sensitive scalps. Now once again, most people are not that sensitive, but there is a percentage, maybe 25 or 30% of your population, that is going to be. Now I'm going to do each earlobe, so I'm taking it and rubbing it on the earlobe. A lot of times I take this and I squeeze it together in half, and I place it over the earlobe and like this, and I'll just pull away, and that'll get it. And I do the same thing on the other earlobe. So we've got nice clean earlobes. All right, with that done, we'll take the cap, which we've identified as the front with the triangle. I'll put those two Oh, and before I go any further, look what's hanging out the back. She's going to have an electrical ponytail. We don't want that. So I'm going to make sure that those are on either side of the cap, because we can't change them once we get the cap on. I'm going to place it right in the middle of her forehead, okay? And I can take these two fingers and hold it in place with those two fingers, if I don't stab her in the nose now. And then I can pull it over. But what I'm going to do instead of that is I'm going to show you what a lot of people do when you're starting out. This is the easiest thing to do. I'm going to ask her to hold those in place. Can you just hold those in place? Those two buttons? Yeah. She's going to hold those in place. And now I'm going to ask her to just make sure my little things are on the side, to just put a little push against the cap as I put it on. See? And it went on real nice, just like that. Bada bing, bada boom. And you are done. All right. Now the next thing I'm going to do is I'm going to line it up, make sure everything lines up properly. I want to make sure that these are right over her eyes, these front two. This goes down the midline. I want to make sure that either side is over her ear. So there's her ear. Yep, it's right above it. That's T3 over there. And we're going to pull it down and back. That's nice. There we go. These are in the parietal region. These are in the occipital, and there's the edge of her scalp right there. And so I know that I've got the occipitals placed well. So that's a beautiful setting. And that cap fits nice. She's right in the middle of the red range, so it's not squeezing too tight. How does that feel? Does it feel okay?
Yeah.
Yeah, that's a nice fit. You're going to get a good, really good results from that. Then we're going to take the ear clips. Now these little ones that clip like that, as we said before, were previously used in the Inquisition, and so we're going to use them here. But you can purchase ones in different places that are like the grass gold clips, which are soft and are gentle on the ears, and a lot of your clients will like that better. Depends on the sensitivity of the person. And you can put a little bit of electrogel in there, like that. We've got the electrogel in that little cup there. And then I'm going to take it and I'm going to place it on the earlobe right here and clip it on. How are you doing with that? Is that okay?
Yeah, it's okay.
And then I put the connector from the cap to the ear clip. So we can see that that's done nicely there. I'm going to do the same thing on the other side. Put a little bit of fluid. I usually have a paper towel down in case some of the fluid drips down. Not a bad idea. And then I'm going to go look for this ear lobe over here. Put that on there. So I've clipped the ear clips on both sides. And we're good to go there.